Welcome to the Start PT Now podcast. We got a really special episode here ahead. We're joined by two amazing physicians and medical professionals. First off, I want to say a big thank you and introduce Dr. Aulakh from Regenerative Orthopedics Sports Medicine. Dr. Aulakh, thank you so much for joining us.
My pleasure.
And on the right, we have Dr. Jonathan Stacey, DPT from our only office here at Physical Therapy and Sports Medicine Center. Dr. Stacey, thanks for joining us.
You're welcome. Thank you.
Well, awesome. Well, this is a really great opportunity to share the knowledge that you guys have, especially with those people who are dealing with injuries or maybe other ailments and are trying to get into their best shape and their best living. Starting off, I know in the lead up here, we talked a lot about arthritis and those sort of chronic ailments. First, I just wanted to direct a question to you, Dr. Aulakh. As someone who believes exercise is the best medicine, how do you integrate physical activity into treatment plans for patients with chronic conditions?
So, one thing that I always kind of emphasize, with my patients is that, movement is like the human body is basically designed to move, so simply staying, sedentary, is not, is basically it's going to cause a lot of problems, your muscles get weaker, they atrophy, and if once in a while you have to get up and do something for slightly extraneous period of time, a lot of these symptoms that have been slowly building up over the years will eventually catch up to you, right? So especially in arthritis that is very chronic, it is something that one kind of like develops over the course of the years, but usually they usually don't have any symptoms unless once they cross that threshold for pain, right? So that becomes, so to keep your symptoms at bay, the best thing to do is exercise, get physically active. Not only helps strengthen your muscles around your joints and stabilize them, but also mentally is also it's quite refreshing as well. So that's why I would say especially with my patients with arthritis, it's if you don't like to do boring things by yourself in the gym, pick up a sport, something that you can enjoy with your family and friends, and you have fun while at the same time keeping helping keep your joints healthy and strong too. Yeah.
Right. And a lot of times we see injuries come from the exercise, and so it's slowly building that back up. And especially in the case of arthritis, finding those ways, like you were saying, to make it fun. We're definitely in the movement business ourselves with physical therapy.
Yeah.
And we see a lot of patients who come from a sports medicine sort of area. And so I wanted to then turn it over to Dr. Stacey. Just ask, in those cases where you're seeing someone who's come from maybe a sports medicine physician, how do you go about sort of evaluating that patient?
The first day we're going to do an evaluation, and for me the purpose of that evaluation is really to get to know the person,
Right.
And that's not just about their the area of their pain, but what are they trying to do, what are they currently doing. If it was an injury, say in a sport that they enjoy, I really try to find out what level of commitment they have to that sport, or for example someone who just goes to the gym or whatever, but that's their way to stay strong, and now they're having pain that's limiting. Is trying to find out not only exactly what happened, I'm almost like a detective, like an investigator when I'm asking
Right.
the questions. I'm trying to find out how did it happen, but also what other factors that maybe they didn't think about might be contributing to it. It could be comorbidities, other disease processes or other problems that they have that may be contributing to either the mechanism of injury or to the pain that they're having. So I try to look, for example, someone having knee pain, I try to look above and below that to see if there's any other issues that they're having that might be either contributing to their pain or may have contributed to their injury. So we really try to really get to know the person, not just on a personal level, but on a level of understanding their movement characteristics and how we can intervene to improve those, not just through exercise and manual interventions, but patient education. Because really what I'm hoping to achieve with each patient, based on what I find in the evaluation, is not just less pain, improving their function, but preventing them from having to come back. I really
Right.
have a push towards let's get you better and discharge you and help you understand how to avoid this in the future, whatever that specifically might be. So that's kind of how I start and how I kind of push off. And then we take it week by week, day by day, week by week, and month by month, depending on how long they need us. Some people, they get an evaluation and that's it. and that's all they need. Other people are there for weeks and months, depending on their condition and their progress and their age and all these other things.
Definitely. And you talked about finding that root cause, trying to identify where that really is stemming from, those issues. Dr. Aulakh, I wanted to throw it back to you. If we're talking about arthritis in this case, what are some early signs of arthritis that people often overlook, and when should they seek medical attention?
Yeah, so like I was saying, the arthritis is it's a very slow, insidious, chronic process.
Right.
So a lot of times, initially when, patients, they start experiencing, kind of like just generalized deep pain in their joint. And usually they attribute this to I just today, went for a longer walk, or, and it's usually at the end of the day, at the beginning of the day, usually they feel fine. And then by the end of the day, I can really feel that.
Right.
And they just usually attribute it to just because I worked out a lot, I did extra work today at my job, or did it overtime, and just kind of, just overdid it, like an overuse. And so usually they feel better after they go to sleep. They'll take Tylenol, or they'll take, any anti-inflammatories. And usually by the morning they feel much better, but then they kind of repeat the whole process again. They go to work, or, and then again by the end of the day, or by the end of the, day, the symptoms kind of return. So, and they kind of just, like I said, they overlook that, I just overworked. And then usually say, for example, by the time the weekend comes, they're because they don't usually do well, people usually rest and relax over the weekend, so they do fine.
Right.
But then come back to the start of the week, and then kind of as the week goes by, it just kind of gets worse. And so they kind of just attribute that to I'll be, it's just I just overworked it, which is true in some sense. But they don't also realize that, hey, you're starting to have now this degenerative process, and it's kind of getting your attention, especially at the end of the day. And that's very classical for osteoarthritis. Sometimes depending on the type of the arthritis, some patients will feel a little bit more stiff in the morning, but then as they warm up in the day, they start feeling better. But then again, by the end of the day, they're I'm just gonna get the same kind of pattern cycle again. So, and a lot of time they just overlook that, and eventually their symptoms get worse and worse, or the arthritis starts to progress, and now it's becoming more constant. And that's when they come in, and a lot of time, by that time, it's okay, we've already have a lot of this damage done, right? So, and then that's when they first come in and seek, seek medical help, and also these are the, obviously, people live their lives, they have to go to jobs, but taking the time out, even exercising, or it's kind of this balancing of your work is what we call the work-life balance. But part of the work-life balance is that you have to take care of yourselves. So, but generally speaking, it's just something I just overdid, and people just overlook that, and they're it'll just get better by itself.
Right. And it kind of begs the question for me. I wanted to follow up. Are there any unique treatments that you guys offer to help deal with that sort of pain and that chronic ailment?
Just if someone comes for the first time, to me, and they're I've got this knee pain, I know, we take x-rays. Because obviously first you want to just rule out anything that's too obvious, because, when someone comes with pain, there could be a bazillion reasons why they could be having pain. So we take an x-ray just to make sure we kind of evaluate what the joint space is like. We're all right, and nice thing about ROSM is that we do have an ultrasound in our room, so we can even quickly do an ultrasound exam while they're there, just to see if do they have a Baker cyst at the back of their knee, or if there's more fluid buildup in the general knee joint. We take a look at their tendons and the quad tendons. We can take a look at their patellar tendons. We can take a look at their MCLs, which is running along the inside of the knees. We take a look at the tib-fib joints, again, just to see if there's any sort of tendinopathy, and we can usually pick that up from the ultrasound. I would say with ultrasound, while it's a great tool, obviously we cannot see past deeper. It's more difficult to assess the deeper structures. So usually if we're all right, having this general, and again, their history matters a lot. It's something that's been going on for many years, kind of having this pattern of not too bad in the beginning of the day and worse at the end. So that's kind of all right, that's more your classical wear and tear. So in my treatment approach is usually especially with someone who's never done physical therapy, and really so what I call the treatment naive patient, I go stepwise. You'll be okay, let's start with some basic stuff. Start with some physical therapy, strengthen your quadriceps, your hamstrings. And with knees, actually kind of just to take an example of a knee, everything is kinetic change. So if your core muscles are stronger, your glutes are not firing, then now when you're walking, you're not really walking in a straight line. It's like you kind of like scissor in a bit.
Right.
So then that puts kind of like more pressure, like stress on the knee, and I'm sure Dr. Stacey can I'll refer that to him. But getting your core muscles strong, you're stabilizing your sacroiliac joints, the ligaments, all of these work in tandem. So while the primary source can be the like arthritis, but unless you don't stabilize all of your other mama muscles, then kind of like you kind of get into that pattern. And a lot of times I stress with my patients, like, look, even a lot of times I see people, going to physical therapy actually doing well and their symptoms are getting better.
Right.
But then it's like, and I also stress that it's like, okay, make sure you learn those exercises too. So that even when you're done your sessions and you're feeling better, you want to keep your symptoms at base. So don't stop doing them, continue doing them. It's going to be basically part of your life now.
Yeah.
So, and a lot of times patients who come back, they're like, yeah, I felt great, going to physical therapy, but now it's returned. But then when I dig a little further, like, yeah, I didn't really continue those exercises and kept getting stronger.
Right.
And now everything comes back.
Yeah.
So kind of like stressing that, hey, now, this is going to be part of your life now. You have to take care of yourself, so, just going to physical therapy and just in the office and not doing anything after that is not really an option too.
Right.
If you want to keep stronger and you want to, avoid any major surgeries down the line, because arthritis is something that you cannot actually cure per se unless you replace a joint completely.
Yeah.
It's just something you can sort of slow its progression down.
Yeah, manage and
exactly
sort of take it step by step. It's such a multifaceted process like that, and there's so many steps along the way and different factors that go into that sort of thing.
Yeah.
And managing that. I wanted to turn the floor to Dr. Stacey because there is the physical therapy component of it. When we're talking about arthritis, what role does physical therapy play in managing that sort of chronic condition?
Just kind of going off what Dr. Aulakh was saying, about teaching the patient and encouraging them to continue after PT. We use the time that they have in PT to demonstrate to them the benefits of the specific exercises. And when I say specific exercises, literally with my evaluations or in a PT evaluation in general, our goal is to find where they're weak, where they have deficits that need intervention versus just like a general exercise program. So we're very specific based on our evaluation. It helps us. I always tell the patient on the first day, we're getting to know you today so we know where to start.
Sure.
But then we start at a place and as we go along, we assess the patient's response to what we thought they needed to start with, and oftentimes there's modifications along the way, but the end goal is always to develop a home exercise regimen based on what we started with and then developed over the course of their PT. So it's always with that in mind, because they may not have a perfect resolution of their symptoms, but they become more functional, stronger, maybe less pain throughout their PT course. I would never promise no pain after it, but they came for a reason, and the reason could be I'm not able to do the things that I like to do as well. I'm having pain with just general mobility throughout the day. But again, we start at a point, and it's a progression to get to that exercise program that has been carefully created and modified as we go along to get them to that point. And then knowing all that work that went into it, making them aware, like, this was a lot of work. You came in here, you did all these exercises. We really put some thought into this program for you, not just to do for a month and then be done.
Right.
These are problems that built up over years, months and years, that aren't going to end in a month, right? And so if they see that benefit in a month or two or however long they're at PT, then they start to be sold on the importance of it. Usually, some people, they still require some extra encouragement or whatever, and so maybe someone after they finish physical therapy might benefit from having personal training or other kind of things like that to kind of springboard off of what the foundation that we worked on and built up over their time at PT, and with any of the recommendations that they got from their physician. It's all an education process, and just not only just helping them get better, but showing them the benefits and teaching them the importance of continuing that throughout their time after therapy.
Definitely. And I think the thing that's so powerful about the process, and especially this area where we have so many great physicians around, it's like you have so many resources of people who will help you in every step of the way, every aspect of the process. And I think it's an interesting topic to think about, at what part of the process are certain specialists needed. So I wanted to flip it back over to Dr. Aulakh and ask you, in managing arthritis, how do you decide when to integrate physical therapy into that care pathway?
A lot of times I would be like, well, if the patient is still in pain, I can, for example, start doing some basic treatment while I can stack up physical therapy on top of that. Right. So what would that be? So, there are a lot of types of injections, for example, hyaluronic acid injections or gel injections. Yeah. So I can start off with that. Usually I'll tell them okay, you're going to be sore for a few days, because after all it is an injection. Then once you start feeling better, things calm down, then you can start physical therapy on top of that.
Right.
In terms of more regenerative treatments that we do, again, depending on how severe the arthritis, if it's something that's very mild, I would probably start with something like prolotherapy.
Right.
So prolotherapy is something where we inject a dextrose solution, which acts as an irritant, to sort of help kickstart the healing process. And then, like I said, we can usually, I say, take it easy for 4 or 5 days, because they'll be sore. Because, like I said, we're trying to induce an inflammation there to kick the healing process going.
Right.
And a lot of traditional sportsman medicine too. If you think about it, they'll do physical therapy, they'll do gel injections, they might even do some corticosteroid shots. Corticosteroid shots, they're, while it's a great anti-inflammatory, it doesn't do anything in terms of healing things. So if someone was on fire, or they're I really can't participate in PT because of my pain, then occasionally we will, maybe once in a while, maybe we'll do a cortisone shot to calm things down so they can at least participate in PT. But even with steroid shots, I usually, warn them look, this is, we can do this, but it's not the healthiest for the joint, because it, increasing your chances of wearing and tearing. And it makes you feel great, but it's it doesn't do anything in terms of healing it, because it shuts everything down. It's very strong anti-inflammatory. But if that helps them to sort of kickstart their physical therapy and participate in physical therapy more pain-free, then then great, that's fine, we'll do it. But it's like I said, I usually would tend to avoid that as much as I can, unless it's no other option.
Right.
And then, like I said, so we can do all of this in tandem too. Other regenerative treatments that we do is PRGF or PRP, where it's a little bit more of a stronger inflammatory response compared to prolotherapy. But usually I'd still want them to start physical therapy about 10 to 14 days even after I do the procedure. Yeah. Again, to sort of help build those stabilize the joint, by strengthening the muscles around the joint. And a lot of times, when physical therapy is it's never, sometimes I don't sometimes do it always as a standalone. It's going to be sometimes even in combination too, right? Because you get that added benefit on top of that.
I wanted to flip over to Dr. Stacey and ask, from your end, how does collaborating with sports medicine physicians enhance your treatment outcomes in your experience?
There's a couple of different angles to that. So sometimes I'll get a patient who either came to me directly and I evaluated without a referral, and they may hit a roadblock along the way, and there may be a pain or a problem that I know needs an additional intervention. And so I have those resources to refer to sports medicine or to any of the specialists. ROSM's a good referral for me for my patients, because you guys do something very unique there that I don't have the ability to refer anywhere else for a lot of that stuff. So I'll often, this might be a person who in the past has gone and gotten steroid injections and some of the other traditional interventions, and they know that those things may or may not work for them. So we may hit a roadblock, or we may hit a point in their therapy where they're struggling to get past a point, and the interventions that we have to offer may not be enough. So just having that resource of ROSM, for example, to refer to then say, hey, this person needs an additional something that we're not finding or getting. And we get a couple things back. One is the person goes there and gets a very detailed evaluation, and you guys may see something that we either missed, or maybe was something we overlooked, or just needed a deeper dive, so the ultrasound imaging or some type of imaging to really figure out what is this pain truly coming from. And so having that resource to refer to is great, because then our patients eventually feel better about, their outcome because we weren't just saying, we need to solve this problem in PT. If someone needs more than what PT has to offer, then absolutely they're going to get a referral to someone who can add to that mix. And it's very collaborative. The notes I get back from referral are always very detailed, always shed light on, versus like sometimes you may just see a referral that says, shoulder pain, figure it out, so we've already tried to figure it out. But then I get back a very detailed explanation, and it's, very thorough, and the patients appreciate that they referred somewhere, that they got a thorough evaluation and a good communication back to PT to know what do we need to modify or change or continue, but just with that intervention. And then the other side is we do get patients that come from there, that went there originally and got some treatment, but same thing, we get great information from that, so I have a better starting off point versus like trying to figure out from day one, where is this coming from? I already have a great idea, so I get my information from the patient themselves or from the referring physician, and getting that information from you guys that's so detailed is super helpful because it really gives me like a better place to start. So we're not trying to figure things out as much at the beginning. We have more information, which gives us a better starting point, which helps them get better sooner. So in addition to the interventions that they're getting there that are also helpful in and of themselves. So.
And that communication is so key. It's a whole process, and especially when you have multiple people involved, that's what really helps it all come together. I kind of wanted to shift it over to Dr. Aulakh and ask you, in your experience, how do you and physical therapists coordinate care plans to ensure a patient's supported holistically?
Yeah, so one of the things, like for example, if there's a treatment naive patient who's never had physical therapy, obviously we come up with our diagnosis first, right? And we're like, all right, this is what we think is going on, XYZ, and then we'll be like, okay, let's start some physical therapy. And then a lot of times, we'll get physical therapy and like, okay, we've worked on this. And again, depending on the patient's feedback too, we're like, yes, we did all these things and I'm feeling great. Or we can be like, yeah, we've made some progress, maybe like 50-60% improvement in pain, but we're not quite there yet.
Sure.
And they kind of like, they work with physical therapists, and sometimes, if you cannot break through that last little bit, then, I might get a feedback from the physical therapist saying that, hey, this is some areas that we've been working on, not really breaking through, see if we can maybe do some treatment, like something like prolotherapy or PRP, and then see if we can sort of break through that last little bit, and then hopefully so we can kind of like go back and forth. So sometimes we'll have patients who already will have marking on their body saying, hey, this is what, this is where the pain is from, so let's put it under the ultrasound and see what's in there, if we can, and then maybe we'll just start treating those specific areas. If if it helps, great, then we know that we've gotten. But if it's something that kind of like either with the physician or the therapist, if they're like kind of stuck and they can't figure out where the symptoms are coming from, then obviously getting a more detailed imaging like MRI will certainly help with that, because at the end of the day, if patients not improving in their symptoms and we've kind of like done a lot of our due diligence, then it's time to sort of like think about, okay, maybe we should just get some advanced imaging just to see if there's anything else that's going on, because sometimes you'll get this weird instance that, there was a there's some, like maybe there's like a bone, it's like some sort of a bone cyst, or there's some sort of calcification that maybe for some reason could not have picked it up on the ultrasound or whatever reason, but at least those advanced imaging will give us those answers, right? If, for example, the imaging, if the imaging, everything like we did and comes back normal, and we're kind of still working on that. Sometimes it's just a slow progress. It's just that, yes, it's improving, but it's like just the rate at which things are improving may not be as fast, because everyone is going to be slightly different. But having all these tools at our disposal, and then kind of working with the physical therapist saying, hey, let's try and change this, or try and see if we can treat this one specific area. They're like, well, everything else is feeling much better, but maybe this one little area that's like, we're not quite there yet, so see if we can just target that one area, and then hopefully, majority of the time, usually things are much better, because even from a patient's perspective, they're like, okay, and like the whole team is like, the team is on board, and they kind of feel great that, hey, it's not like an isolated, like one person is saying that and somebody's, so that kind of coordination, even for the patient, is like, it gives them more confidence in terms of the treatment too.
Yeah.
So
Strength in numbers, strength in resources. If you have so many resources, you feel
Yeah.
more assured. You're like, okay, I got
Yeah.
multiple eyes on this. I have
Yeah.
multiple fields of expertise looking at this.
Exactly, yeah.
You got to feel more confident at that point.
Especially if I'm seeing the patient for the first time, I usually patient education is one of the biggest things. Given our current the way medicine is practiced, spending time with the patient to explain them, okay, these are all your options. This is what I'm thinking in terms of your stepwise approach. If A doesn't work, we try B. If B doesn't work, we try C, and we kind of go from there. So at least they know that, okay, if something doesn't work, there's other tools under our belts that we can actually use to address your symptoms. But again, this is like a tango between sports medicine and physical therapy that sometimes gives the best outcome.
Definitely. And you talked about those different tools. I know you've mentioned some things like various injections or alternative sort of methods of treating these things. And it did bring to mind for me, I know you have a background in medicinal chemistry.
Yeah.
So I had to bring it up because I'm very interested about that. I wanted to ask how that background has maybe shaped your perspective on pharmacologic versus non-pharmacologic treatments for arthritis.
I mean, most of my, when I used to, so before I went to medical school, I worked as a synthetic organic chemist, which is basically kind of like, how you've seen, Breaking Bad, the
right.
guy in the underwear and, cooking up stuff. Literally, that was my job. A lot of the things that I worked was like infectious disease, a little bit of, that was the main, the main one. And, with infectious disease, it's like, well, you gotta, make something that kills the bug. You don't really have a lot of options, non-pharmacological. If something is infected, something that's a new bug, you got to find a way to, that's all. And, a lot of times even in terms of antibiotics, this been the process in that field usually typically has been more challenging just because some of the, the drugs that or the new compounds that we make are more challenging to synthesize as well. So, organic chemistry kind of brings in, it's like a nice tool that we use to sort of either modify, naturally existing natural products to make it either more potent or less potent. And then there's a whole slew of, safety as well, because with drugs, yes, we want to always weigh the risks and benefits.
Right.
We want to make sure, obviously, the risks, the benefits outweigh the risks, so that, because every time you take a drug, it's not without its, side effects too. So, and sometimes, so if someone has to take it, they have to take it, they have no choice, right? But, being on the other side of the fence in the pharmaceutical industry, I was a scientist and I work with other brilliant scientists too, and, they're, looking in their contribution to my medicine has been it's just insane. It's just amazing. Without these organic chemists, you wouldn't be able to do surgeries because you wouldn't be able to have anesthesia. You wouldn't be able to do Tylenol, ibuprofen. These are all, even the steroid shots that we usually give, has been synthesized, somewhere, or else in the, back when we didn't have this capabilities, even getting a few milligrams of steroid, they would have to slaughter around how many animals, and it would be it would be worth more than gold. But now with the power of synthetic chemistry, we've made everything more accessible now. But with medicine, yes, it's you want to weigh the risks and benefits. Hopefully the benefits will be better, but like I said, every drug has some sort of side effects, right? Which is why it kind of brings me back to this whole idea of having living a well-balanced life. I would say, yes, you want to, you have life, you got family commitments, but at the same time you got to learn to take care of yourself too, because eventually it's going to catch up to you.
Right.
So, and we want to try and whether that be in terms of hypertension, cholesterol, diabetes, these are all things that are actually preventable. Yeah. So greater than, I'm sure, more than 90% of the, if you're able to control your blood pressure, you won't be able to get, if your blood pressure is controlled, risk of stroke goes down. Same thing with diabetes and cholesterol. You have uncontrolled diabetes, your nerves starts to get affected. And along with that comes, your kidneys gets affected too, as people who end up going on dialysis. So just by, exercising and, living a healthy lifestyle will get rid of all of these, comorbidities, and you live a good, healthy, life. And up to, I tell people, like, hey, if you're not doing it for yourself, do it for your kids.
Sure.
So in this way, you're around, to see like your graduation of your children, they're getting married. So even sometimes that will give them a good enough motivation to start taking care of themselves.
Definitely. And you have so many great physicians like you both here who can help you along the journey, but you do need to have that discipline, that consistency on your own as well to make sure you can follow through with that expertise you've been given, with that plan that's been laid out, so then you can get to that point.
I mean, at the end of the day, as physicians, we do our part in terms of like educating the patient, like, these are, what you have to do. But then at the end of the day, it's also up to the patient too. They're also part of that. They're also part of the team too. It's not just, the physicians, the therapists, the sole responsibility doesn't just lie on them, but it's, at the end of the day, it's their body. It's their decision as well. So, they have to make that commitment for sure. Yeah.
And I know we're getting right above our time here, and I want to thank you both again so much for carving the time out today to speak with us, to share this expertise, because I know so many people online are going to find this immensely helpful, especially in their journey, whatever it may be. You have these two great professionals here, amongst many others, who are available for you and willing to help you through the process and get you to your best fitness, your best physical condition possible. I just wanted to wrap up by saying thank you again to you both for coming in here, sharing your knowledge, speaking with the people, and looking forward to connecting again soon.
Thank you very much. It's a pleasure.